but the longer we maintain our social distancing, the faster we'll flatten the curve, the faster we'll all go back to work, and businesses will be back to thriving again.
Everybody, on today's show, back again, Dr. Luciano and Dr. Shiloh, updating everyone what's going on in Bucks County, Philadelphia, Montgomery County, and what's being impacted locally. You know, doctors, thank you for being on the show on this Sunday. It's a beautiful Sunday. We're seeing it hit home more. We're seeing people that we know locally. We know, I'm not going to mention his name out of respect, but one of our friends, Dr. Shiloh, is down on a ventilator and in a hospital right now fighting for his life. We know other people now have it here locally. What are you seeing? Can you give us a quick update, Dr. Shiloh, what you're seeing out there?
Yeah, Lance, thanks for asking and having me on again. What you were saying is totally true. I think what we're seeing, as I said last week, is I know several people who are sick, including the person that you mentioned, but it's hit even closer to home because I have some close family members who are now tested positive and are doing well as of now, but they're on home quarantine. I think what we're going to see, and we can see from the numbers in Bucks County and everywhere, is that soon enough, everyone's going to be affected by this personally. They're going to know somebody. Unfortunately, they may know people who are really sick and maybe even die. So in the coming weeks, I'm pretty sure everyone's going to become affected more personally. And then I think maybe then everyone will definitely understand the severity of the issue and why we're staying home and why the businesses are shut down, et cetera. So that's what's changed for me.
Dr. Luciano, has anything changed for you? What are you seeing out there? Have you been testing any patients?
Yeah, so obviously everyone sees the ticker on the numbers going up, nationwide and locally. This is expected. We're expecting a surge over the next couple of weeks, and this is reflective of the nature of this virus. It's contagious and it's lethal. So and it also has a lag period. So basically the data that we're seeing now is from a couple of weeks ago. The incubation period is long. And the people that are in the hospital that are sick, it takes a while for them if they are going to go downhill. So this numbers that we see are reflective of a couple of weeks back. So we expect this rise, and we expect it to increase in a couple of weeks. Personally, I've seen an increase in ICU stays from my colleagues, as well as hearing from other colleagues in New York. It's getting very saturated in the ICU. So. Certainly you're seeing a ton of more cases, which is not unexpected. We do see that social distancing is working, though. It's our only tool at this point that is helpful. So that being said, we're getting some more information about this whole asymptomatic spread, which I think will kind of dictate what happens as far as how long we're going to be quarantined as a nation down the road.
Okay, Doctor, you brought up something. You're on the front lines. You have two beautiful kids. You have a beautiful wife. You have a nice family. Dr. Shiloh, I think you have 10 kids over there, but I think you have 4 or 5 kids, right, Dr. Shiloh? You have a beautiful wife also. I see doctors now, and I'm seeing that nurses are committing suicide, doctors are passing away. You guys, and I have the utmost respect for you. I just had this conversation. My sister's husband's a doctor, and he has to quarantine himself right now, because he was exposed. They don't know if he has it or not, but he was exposed, so he's quarantined. A friend of mine, his wife's a nurse at Penn, and I said, you got to be scared. You have 2 beautiful daughters, Matt. Because I said it to my wife, and her response was, this is what I'm meant to do. They need me now more than ever. Is that really the mindset that you have? I know we're in a war, but God bless you. I mean, the mentality. Can you talk about your mentality of you're still seeing and treating people? Can you tell me about that mentality? Dr. Luciano?
Yeah, so I mean, you're absolutely right. I think most of us that got into healthcare, we have that instinct to help people. So our first instinct is, you need me, I'm there. And so, I basically volunteer services if needed. I put myself on the list for New York as well as here. If they need me inpatient, but I do have to think about, I do have family here. Most people that are working on the front lines, they come home, they get in quarantine, they don't even see their kids. They don't want to risk spreading that virus. because the asymptomatic potential spread, and then the real big concern for these healthcare providers, you see a lot of people get sick really quick, and these are healthy, younger people. And that brings up the notion of, what is this, what's happening here? I thought most people are, overcome this fine, but I think we're learning that there might be some virus, the amount of virus you get exposed to will dictate your symptom and the severity of it. So as a healthcare workers, they seem to get more of a dose initially versus the general public that doesn't. So, it's a concern. There's a lot of, a lot of people are scared out there, but, it seems to be, a heroic response, because despite that, they're still, doing what they need to do, because this is what they signed up for. And, who else is going to do it? So, thank God we have people like that out there.
Dr. Shiloh, are you scared, doctor, going to work every day? Are you scared treating people, Dr. Shiloh? Can you tell us how you're feeling?
I don't think I'm scared. I think that, first of all, in my field as an interventional radiologist, I've been gowning up, putting on masks, and treating people as if they have a communicable disease my entire life. I mean, HIV, when that was really predominant, hepatitis C, which had no cure up until a few years ago. So for me, it's not uncommon to be prepared to gown up and treat everybody like they have a disease. That doesn't mean that I don't have a really serious, healthy respect for what's going on. I come home from work, I disrobe in the garage, throw my clothes immediately in the laundry, and go take a shower without saying hi to anybody. And I know people in New York and other places who really avoid their family completely, quarantine themselves in a room in the house for the duration. So, I'm concerned and I'm cautious, but I'm not scared. As Dr. Luciano said, this is what we've been doing. This is what I've been doing my whole life, dealing with blood and other products that can potentially cause a problem for me personally. And I just know that my job is to take care of people. That's what I went into this for. So that's what I continue to do.
What's the data showing us here locally? And thank you both for your service. I want to make that clear. And I respect you both tremendously as a community. What's the data showing you? Is it growing here in Bucks County, like you're saying, in the Philadelphia area? Are more people dying? Can you kind of one of these two, Mike, Dr. Luciano, or Dr. Shiloh, either one of these two? Dr. Luciano, I'll let you go first.
Yeah, sure. So we're seeing it grow everywhere. Specifically with the numbers here, I think I looked this morning. Philly's got, Pennsylvania's got 10,000 cases, 2,600 in Philly, and about 500 plus in Bucks County. So, everything's increasing exponentially. This is not unexpected.
So a lot more less, Dr. Luciano, or no?
The more people are being tested, absolutely, but there's been, more virus spread. We don't know.
Yes, I apologize, Dr. Luciano. Are more people dying from it? Is there an uptick?
Yes, absolutely. So the more that we have it, the more people are dying. So we have about 130 deaths in Pennsylvania, 24 in Philly, 14 plus, and this is always going up. So, we understand that that's going to happen next couple of weeks, and that's when we expect this surge. So this is not the worst of it. So like I said, there's a lag time, and what we're implementing as far as social distancing, hopefully will reflect after that period. So expect it, but don't fear it, and understand that you're still doing something to minimize it. Yeah.
Thank you, Dr. Luciano. Dr. Shiloh, the next question for you is, there's a myth out there, I believe. I don't know if it's a myth, if it's true. I don't know the data as well as you do. But I know young people that are getting this. I've heard of 2, 3 young children that passed away recently here in the United States. We have a mutual friend that's fighting for his life. It's my age, in better shape than me, and he's fighting for his life for understanding no pre-existing conditions. Is this affecting everyone, Dr. Shiloh, or is it just still only elderly people with pre-existing conditions? Because that's what a lot of people still think. That's what I'm being told when I talk to people. Can you please tell me, Dr. Shiloh, and everyone else?
Yeah, well, the data from the state of Pennsylvania shows that as of today, and to echo what Mike said last week when we spoke, there were about 200 patients in Bucks County. Now there's over 500, so you can see the growth. We're still seeing that 20% of the positive tests are in patients over 65. That means 80% of the positive tests are people under 65. So plenty of people under 65 are getting testing positive for the virus. Approximately 50% of those hospitalized are over 65, which then means 50% are under 65. So yeah, Lance, it's totally true that there are people who are relatively healthy or really healthy people who are getting sick and dying. We wish we understood more significantly what predisposes someone to get real sick. If you talk to immunologists, there's this sort of Goldilocks theory where you have to have some immunity, not no immunity, and not too much immunity, just right, and you don't get too sick. So I wouldn't use your age as a barrier to, hey, nothing's bad going to happen to me. We know personally people who are our age who are really fighting for their lives, and we know young people who have passed away. So you still have to be very, very careful and vigilant.
Yeah, I know your twin brother is one of the world's leaders in infectious disease out in California. Is that what he's saying, that it is affecting everyone in every age group, and it's just, I don't want to use the Goldilocks rule because I really don't know what it is, so I don't speak about it, but it's kind of hit or miss if you get it and die or if you get it and beat it? Because it seems like, I mean, I don't know, it seems like anyone could get this and pass away from it. Is that an accurate statement?
Yeah, it's true. I mean, again, we're not sure why people get what really leads to the end game, which is this what's called the cytokine storm, which is just your immune system overreacting to the insult of the virus. So again, that's the overreaction leads to this storm, gets your lungs to be really sick. We're really still not clear as to who gets that and who doesn't. Versus someone who gets it and either doesn't have any symptoms or has a little cold-like or a sore throat. So yeah, they don't know. There are a lot of people studying that. His lab is studying that now. And hopefully soon we'll have some answers that will help with treating people before they get that sick, so we don't have as many people who end up in the hospital on a ventilator.
Here's a question for you, Dr. Luciano. I know you have a lot of relationship with the local hospitals here. You're in and out of them, and you're help fighting this battle on the front line. Are you seeing a lack of supplies in these hospitals already locally, or are they fine locally?
So I think that the hospital has been preparing. It's hard to anticipate what that surge is going to look like, but supplies can go real quick, real fast, depending on how many patients around here get sick. As you see, the growth is exponential. So look at New York, what happened there. They're overwhelmed. So there's anticipation of something happening that can create this, a lack of protective gear and ventilators, and they're preparing for that now. So from what I understand in the hospitals that I've been a part of, things are looking like they're prepared now, but no one really can predict what that surge will look like, and if it comes real hard, then there's going to be some need for sure.
Dr. Shiloh, we were having this conversation last night as you were preparing for this. If you get put on a ventilator, and what's the reason for the ventilator? I know it's to help breathe. Are a lot of people coming off the ventilators and surviving? Are they not, Dr. Shiloh, or is that still uncertain still?
Well, sadly, if you're getting put on the ventilator due to the disease, then you're obviously very, very sick. And as I was saying, 50% of the people hospitalized are over 65, and so many of them have many comorbid conditions, diabetes, high blood pressure, obesity, other things. So right now, it's not looking great in the sense that, getting put on a ventilator doesn't mean, oh, that's the good news for you. It actually means you're in big trouble. And the data does show that the vast majority of people who end up on a ventilator stay on it for weeks, which again gets to why the ICUs and hospitals are going to be overrun, because, most local hospitals locally here may have, maybe not downtown, but, the ones that we know here locally may have 25, 30 ICU beds. And if someone takes that bed and is in there for 2 to 3 weeks, you can imagine that soon enough, that ICU is going to be full. And so really, sadly, the data shows that being put on a ventilator means you're obviously very sick. A fraction of those patients will end up leaving the hospital alive. And those who don't, are going to be on the ventilator for a long while if they don't pass away.
Dr. Luciano, where are we at with testing? I'm hearing that there's a 14-minute test. It's a rapid test. And I'm hearing people saying they can't get tested. And I'm hearing a friend of mine out of New Orleans, she's a doctor. She volunteers. So they tested her. It's been 10 days. She hasn't gotten the results back. And so they can go out in the front line and help. She's willing to help. What is going on, doctor, that you're seeing? Is there a 14-minute test? Have you seen that? Are you getting your test for your patients easily? Are they jumping through hurdles? Can you please let me know?
Yeah, so it's a good point. So you hear on the news there's a lot more testing. There's quick turnarounds. It's not rolled out in a mass amount at this point, so there is still a limited amount of testing, and it needs to be prioritized. What I'm seeing is if you can't get a test through the public health department, don't meet the strict criteria, you can order a commercial test through, let's say, LabCorp Request or some of these other labs. The turnaround time for what I've been ordering is not that quick. It's, some cases 4 to 5 days. So keeping in mind, those patients still need to be tested if you're going to change your management. If you're sick, you still should be isolated and quarantined. And if it's take a while for that result to come back, it can't be walking around the community understanding we don't know what the result is. So at this point, it's still an issue. There is a serology test that has also been approved, and I think that's really the going to change this whole structure of what are we up against. Knowing the amount of asymptomatic patients that have been exposed that now have immunity will let us get some more light on the mortality rate. So let's say 50% of people, we mass test everybody, they have antibodies, they're immune, or they've been exposed, is a different state than 1% of the population having that. So that'll significantly affect where our focus is as far as who needs to be isolated, who needs to be quarantined, who's safer to go about in the public. So I think that you'll be seeing that combined with this, a PCR test that tells you if you have the infection. Combining those two will give us the insight we need to know what to do going forward.
Dr. Luciano, you have another side of your business, health, weight loss, beauty, taking care of people. What are you doing to move that side of your business forward? Because as we stated before, you have been impacted, just like every other business. I mean, I can't see a lot of people doing cosmetic things right now in this environment and come into your office for all these different things. What are you doing right now to move that side of your business forward, doctor?
Sure. So, we kept all our employees. There's a side of the business that can't run specifically because it's non-essential. There's no need for people to be getting that service at this point. So my focus right now is on my patients. I do have a primary care practice with a focus on, just me and that patient, really personalized care. So, I'm in constant communication with them, sending out emails, sending out content, checking in on people, and educating them, because knowledge at this point is power, knowing why you're doing what you're doing, and also taking care of their chronic issues. I've been on the phone countless times with patients. The other night it was 1:30 in the morning. Someone called wondering if they need to go to the hospital. Everyone's scared to go get checked out. And this was cardiac symptoms, so someone staying at home wanting to expose themselves to a hospital because of fear of contraction of virus, they could be having, a cardiac event, a heart attack that they're ignoring. So, it's important to be there for them, and I'm doing my best to do that as far as the medical weight loss. I also am boarded in obesity medicine, so that part of the practice I'm able to do virtually as well with telemedicine, and trying to put out some helpful information to the community. Everyone's kind of stuck at home. A lot of people overeating, that could be a big issue for their health. So keeping everybody healthy right now is also a big part of this doing your part. So we're overwhelming the hospital system. Taking care of people is really what my focus is.
Dr. Shiloh, what are you doing to move your business forward right now in these times besides building the Death Star behind you? Can you tell me what you're doing?
Right. Well, I appreciate you asking. Yeah. So we're also doing some virtual consults. So if you have a disease state that we treat, we're happy to see you and talk to you about them. And, again, even with due respect to the virus that we're talking about now, and obviously it's really the headliner, people are at home. Many people are staying at home all the time. And so we figured we'd put out some educational content just to educate so that when this is over, if people have a specific problem, they can get it addressed. So to that end, on this coming Tuesday at 2:00 Eastern time, I'll be doing a webinar on varicose veins and the treatments for it. If you want to sign up, you can register. You can either go to usaveinclinics.com. You can go to my Facebook page and find the registration. If you register, then you can see the event live. And then if you can't happen to make it, then it will be taped and you can see it subsequently. So we're just putting out content.
That's amazing. I'm assuming that seminar is free?
Yo, it's free, completely free, of course.
Awesome.
Just come in. You'll see me talking about the pathophysiology of the disease and what some of the treatments are. And, again, it's just something to think through when we are able to get out of our houses again and get back to some degree of normalcy.
Well, doctors, it's Sunday. It's beautiful outside. Go enjoy your families. Thank you so much for being here. Everyone, you heard from two of our best doctors around, leading the way in our community. Stay in, social distance, keep working on your business. The Digital Alliance is out on this Sunday. Stay safe, everyone. Thank you.
I think what we have to remember, or the way to look at it, is that you are infected and or everyone around you is infected. If you think of things that way, you will understand that's the reason why you should be at home, and that's why we shouldn't be congregating. You don't know who's infected. You can't tell by looking at them. There's asymptomatic people, as we now know. There's people with minimal symptoms. Basically, if you imagine everyone around you is infected and almost every surface is covered in the virus, then you would imagine to yourself, maybe I shouldn't go out and do this or do that. It's not that important. So my thoughts or my roar would be, remember, it's important to stay in. Don't get discouraged over the next few weeks. The numbers are going to go up, but the longer we maintain our social distancing, the faster we'll flatten the curve, the faster we'll all go back to work, and businesses will be back to thriving again.
There's a ton of clinical trials going out on what is effective and what's not. Okay, so that data will be pouring in shortly. But at this point, there's nothing that we can hang our hat on that this is the cure. This is going to decrease treatment. There's just not enough information based off of small anecdotal evidence. So it's coming, and when those recommendations are available, they'll be available to everyone. So until we have that, we need to make sure that we don't recommend things that aren't going to help someone and maybe possibly hurt them. So that's number one. Understanding that social distancing does work. That's our number one tool right now that can slow the spread. Understanding that more data is coming as the testing rolls out, as we roll out the serology, antibody test, it will give us a bigger picture so we can make the right decisions as far as who needs to be isolated, who doesn't. So the main thing to realize right now is we need time, but everyone needs to do their part. Everyone's united. Everyone has a role to play right here. So understanding that you doing nothing or just staying home is a big part of this treatment plan. And what you do will affect somebody else. If you don't care about your health, you don't care about everybody else in the world, your own family, your grandparents. This is not just an isolated condition for certain people. Everyone is affected one way or the other. So understand that if we're all in it together, we'll all make a nice positive impact.